Assalamu alaikum. Now I would like to talk about some psychiatric problem. Start with a very basic thing. It is orientation. What is orientation? Orientation means patient's ability to know the time and date. Patient's ability to know the time and date, where they are, who they are, time, place, and person. Common cause of orientation loss is alcohol, drugs, fluid or electrolyte imbalance, head trauma, hypoglycemia, infection, nutritional deficiency, and hypoxia. These are the cause of loss of orientation. So again the cause is alcohol, drugs, fluid or electrolyte imbalance, head trauma, hypoglycemia, infection, nutritional deficiency, and hypoxia. Okay, next is amnesia. Amnesia means inability to remember things. If it is occurred before the CNS insult, if it is before the CNS insult, it is retrograde. If it is after the CNS insult, it is anterograde. In retrograde amnesia, there is to inability to remember things, inability to uh, remember things, or inability to make memory before the CNS insult. And if it is occurred after the CNS insult, it is anterograde amnesia. Now Korsakoff syndrome. Amnesia anterograde more than the retrograde. Disorientation caused by vitamin B1 deficiency. Disorientation caused by vitamin B1 deficiency associated with disruption and destruction of the limbic system, associated with destruction and disruption of the limbic system, especially the mammillary body and the anterior thalamus, especially the mammillary body and anterior thalamus. It is seen in chronic alcohol use as late neuropsychiatric manifestation of the Wernicke encephalopathy. Confabulations are characters. Korsakoff confabulation. Confabulation. Confabulation meaning making new things. You are uh, you are talking in a manner that you are making new story. Confabulate means making new and new story about your disease, about the problem. That is confabulation. It is in Korsakoff syndrome. It is especially happen in the mammillary body in the anterior thalamus, and it is seen in chronic alcoholics. Now, dissociative disorder. In dissociative disorder, there is depersonalization or derealization disorder, dissociative amnesia, and DID, dissociative identity disorder. In dissociative disorder, there is persistent feeling or detachment or or estrangement from one's own body. Depersonalization means am I who am I, and derealization means where I am. Uh, in persistent feelings of detachment or estrangement from one's own body, thoughts, perceptions, and actions, or one's environment. Derealization. Intact reality testing versus psychosis. In dissociative amnesia, inability to recall the important personal information, usually following severe trauma or stress. He is unable to remember his important personal information, make it maybe accompanied by dissociative fugue, that is abrupt, unexpected traveling away from home. In DID, formerly called multiple personality disorder, presence of more than two distinct identity or personality state, typically with distinct memories and patterns of behavior. Distinct memories and patterns of behavior more common in female, associated with history of sexual abuse, PTSD, depression, substance use, and borderline personality disorder and somatic symptom disorder. It is formally called multiple personality disorder, presence of two or more than two distinct identity or personality state, typically with distinct memories and pattern of behavior more commonly in female, associated with history of sexual abuse, PTSD, depression, substance use, borderline personality disorder, and somatic symptom disorder. And this is all about amnesia and dissociative disorder.